Hi, I am Dr. Nasreen Gite, consultant urologist in Apollo Spectra Hospital. I'm going to speak in short about urolithiasis or the urinary stones. The incidence of the urinary stones seem to have increased in a recent era, not because of the actual increase in the incidence. It is because awareness or health awareness, and a lot of people are undergoing health checkups. So even the silent stones or asymptomatic stones are being picked up. Speaking about what are the presentations of the urinary stones, it can be asymptomatic in many patients. Generally, when the patient has symptoms, it is renal pain or urinary ureteric colic or the renal colic which the patient presents to us with, or a patient might develop fever also because of infection. Patient has sometimes irritative symptoms like going to the washroom again and again. So how do we diagnose urinary stones? We diagnose urinary stones on the basis of radiology, like we ask for the sonography of the kidney, ureter and bladder. Then if required, we go ahead with the CT scan of kidney, ureter and bladder, and accordingly we diagnose the renal stone. Diagnosing only the renal stone is not enough. We also need to diagnose whether the function of the kidney is maintained or not. That we can do on the basis of renal scan or IVP. Once the patient has been diagnosed with the renal stone, we and the investigations have been done, we categorize the patient, which patient require treatment, which patient require just the follow-up, and which patients require surgical treatment, and how urgent is the treatment. The patients who are having infection require immediate treatment. The patients who have obstructed renal calculi do require immediate treatment, and those patients who are tiny renal stone, non-obstructed stones, they may wait a bit. What are the modalities of treatment? We have medical line of management also for small stones which are less than 6 millimeter. We call it MET, medical expulsive therapy. Those stones which are obstructed or which are large in size, they require different surgical intervention or endoscopic intervention in the form of ureterorhinoscopy, PCNL, ESWL. Nowadays very few patients or negligible patients have to undergo open renal surgery for the large renal stone. In a very neglected patients who have obstructed renal calculus for a large for a quite a lot of amount of patients who develop renal failure because of the obstructed renal calculus, they might require removal of the kidney or nephrectomy. So, in short, do not neglect your kidney stones, and do seek an expert opinion once you are diagnosed with the kidney stone. And let the expert take the decision whether your stone requires any treatment or no, and if requires, which treatment is appropriate.